No one's quitting.
We're joined now by Dr. Birx from the White House Coronavirus Task Force. Dr. Birx, thank you for joining us this morning. We just had that report right there that the National Committee on Medical Intelligence first compiled evidence of a cataclysmic coronavirus event in China back in November. They briefed it to the military. They briefed it to the White House. So why wasn't more action taken more quickly?
Well, I have to say I wasn't here during any of those events. I was working in sub-Saharan Africa on HIV/AIDS, so I don't really know the situational awareness around that report.
Okay, well, we'll follow up with the White House later. Let me ask you, though, about this potential threat from the president to cut off funding for the World Health Organization. Does that make sense at this moment?
If we receive any additional
in the history of the United States and the World Health Organization, we have had times when we've done really in-depth analysis of what has happened. When the president said he was holding funds, he didn't say he was restricting and keeping funds permanently away, but instead said, let's investigate what happened. Let's see what happened in our reporting. We've done that before with previous outbreaks and previous issues that have occurred at WHO.
So there will not be a suspension of funding at this point?
No, not tonight. I'm too tired.
So, we give our contribution annually. The United States is the largest contributor. We always have been, just as we are the largest contributor to a lot of different multilateral organizations. I think that the president wants to complete an investigation of what happened during this current outbreak. Believe me, they already have their continuation funds from last year. So this is a year-by-year commitment to the WHO. This is our required commitment. There's also voluntary commitments that we've made to the WHO through history, including over the last couple of years for HIV, malaria, TB, so a whole series of diseases.
I thought of that.
Let's talk about the spread of the virus right now. What are the most encouraging signs you're seeing right now, and which hotspots give you the most concern?
What do you mean if you can't go to the
So we track on a county by county as well as hotspot metro area. We want to make sure we also don't miss any rural areas. So we were tracking for small outbreaks in rural areas, and the health commissioners and the local governments have handled those superbly, and we're very confident that those were single outbreaks. And then we're tracking the large metro areas. We look at daily case reporting, but I think it's really important that we look at those not only as single days, but a combination of days, and really look for trends. We also look at our testing data to see whether the number of test positives have started to decrease because we're doing a large amount of testing now. So we integrate all of that data. We are concerned about the metro area of Washington and Baltimore, and we're concerned right now about the Philadelphia area. All of our previous areas seem to be steady at least, and then certainly we're looking very carefully at California and Washington to really understand how they've been able as a community of Americans to mitigate so well.
Given what we're learning about all that, is it realistic to think that the guidelines could actually be relaxed by May 1st, or is it going to go on far longer than that?
So we're doing a series of clear investigations of what happened in Washington and LA, and what does that mean, and how you keep the number of cases down. We're also looking very carefully at rolling out and hopefully having soon, within the next 10 or 14 days, an antibody test, so we can really tell how many Americans are asymptomatic and infected. This makes a very big difference in really understanding who can go back to work and how they can go back to work. And so all of those pieces need to come together over the next couple of weeks.
And finally, we all learned that your infant granddaughter was suffering